we have moderate evidence for weight loss. And basically, the evidence is mainly short-term. There are many reports in the literature of significant weight loss in trials of 3 weeks to 4 months on a ketogenic diet. We see favorable changes in body composition and markers of inflammation on this diet. So the evidence long-term is a little bit different. In 2013, there was a meta-analysis of 13 randomized controlled trials, and people on the keto diet actually did lose slightly more weight than people on a low-fat or under 30% of calories from fat diet. They lost about 2 pounds more over a year. They had lower triglycerides, they had higher LDL and HDL cholesterols, and they had no differences in blood pressure, fasting glucose, insulin, A1C, or C-reactive protein. And these are mainly measures of our blood glucose regulation and our inflammation. However, weight loss was similar to the low-fat after 2 years, so there were really no detectable differences. Now, there was actually an interesting metabolic ward study in 2016. You know what a metabolic ward study is? It's a study where people are actually kept in the hospital, and so what they eat is really controlled. They can't sneak anything extra. They get what you feed them, period. And this was 17 overweight men were put on either a baseline, they were put on a baseline diet, and then I think it was one of these where they do the baseline and then go to the keto diet. And so the body fat loss was no greater on the keto than it was on the 50% carbohydrate diet. But this was what was most important, is they actually lost more fat-free mass with the keto diet, which fat-free mass is what? It's muscle, exactly. So you don't want to lose muscle. So that was the disadvantage of the keto over the 50% carbohydrate. The take-home message here is keto diets do promote weight loss and actually appear more effective than many other diets for accelerating weight loss short-term. However, they don't really seem to offer very significant weight loss advantages over other diets long-term, and they have some serious downsides. And we'll be talking about the downsides in a minute, but I just want to make this point. There are lots of ways to lose weight. Anything that promotes an energy deficit will promote weight loss. You could eat 800 calories worth of Twinkies and lose weight. You could go on, you could smoke cigarettes and lose weight. You could go on chemotherapy and lose weight. This was back in the 1920s. There was a huge campaign for using cigarettes for maintaining your slim figure. You know, just because something promotes weight loss doesn't mean it's a good idea. And diabetes, the evidence is that there's some short-term benefits with keto diets: weight loss, improved glucose control, reduced A1C, lower triglycerides, fewer medications. But the downside is this: keto diets do not reverse insulin resistance. So if you're on a keto diet, you get reductions in glucose and weight and all of that, and it looks like your insulin resistance is reduced. So you have a load of carbohydrate. The load of carbohydrate, you get this huge spike in glucose because you remain so insulin resistant. Long-term, there are no long-term studies using keto to treat diabetes in humans, but we have a lot of low-carb studies, and they consistently show favorable short-term, less favorable long-term results. We have a systematic review of studies that are over 12 weeks in length, and there were really no differences in weight loss or A1Cs with the longer-term treatment. But there are a number of red flags, and unfortunately, we don't have long-term studies in humans, or they're quite rare. We have very few of them. But the red flags are that we found that ketogenic diets are associated with fatty liver, systemic glucose intolerance, insulin resistance, insufficient insulin secretion, reduced beta and alpha cell mass, dyslipidemia, and inflammation. And as I mentioned, although human studies are fairly limited. For athletic performance, the claims are big that it will improve your athletic performance, but we only have about 7 studies. They were done between 2014 and 2018, and between 5 and 42 participants each, so they're pretty small, duration about 4 days to 10 weeks, and despite consistent fat loss in the athletes, most studies reported reduced performance, not better performance. And you can just see the summary here. These diets fail because carbohydrates require less oxygen to power muscles than fats. The faster you move, the more carbohydrates muscles burn. And so when you're working at high speed and high intensity, you can't exercise as fast because your energy needs or your oxygen needs are increased, and you need the carbohydrates for that. And then if we look at cardiovascular disease and low carbohydrate diets in general, the findings are so consistent. When we have a low carbohydrate diet that's mainly animal food diet, and this study in 2010, it increased mortality 14%. If the protein came from plants, it actually reduced mortality 23%. And then this study in 2012, The lowest carbohydrate eaters had a 60% increase in mortality. So that's huge. They actually quantified the increase. For every 20 grams of carbohydrate you eliminate from your diet, and for every 5 grams of protein you add to your diet, you increase risk of cardiovascular disease by 5%. That's incredible. In summary, keto benefits are reduction in epileptic seizures, decreased energy intakes, weight loss, improved blood sugar, decreased triglycerides, increased HDL. The risks short-term: increased LDL cholesterol, impaired glucose tolerance, worsening kidney function, reduced athletic performance, bone loss, vitamin and mineral deficiencies, constipation, weakness, fatigue, bad breath, and muscle cramps, and headaches. And in the short term, in the long term, increased all-cause mortality, increased exposure to persistent organic pollutants that induce metabolic disorders and increase birth defects. Persistent organic pollutants are things like dioxins and PCBs because they move up the food chain. Impaired artery function, increased total and LDL cholesterol, kidney stones, nutritional deficiencies, and non-alcoholic fatty liver disease, and hepatic steatosis, which is worse than non-alcoholic fatty liver disease.